Good afternoon, and I hope everybody's warm and feeling safe with this inclement weather. Um, I have a student that's unable to attend due to the weather and other circumstances, so I wanted to put tonight's learning um, on virtually or whatnot, so everyone can actually dive into the material and the learning content at their own time span. Because some are without, we still have some people who are without power. Some people are still struggling with certain circumstances due to the weather. So I wanted to make sure that everyone had a chance to tap into this week's learning and whatnot due to the circumstances. All right. So in chapter 9, we're discussing selecting, administering, storing, and interpreting assessment results. Again, we've been going over this stuff over the last 2 weeks or whatnot, talking about assessing, talking about knowing which test to select based off of the validity and reliability, how reliability is, how consistent the score is, how valid it is testing what they're supposed to test or whatnot. So we want to talk about selecting those tests, talk about administering those tests, and interpreting those assessment results for patients to make sure that we're effective in what we're doing when we are assessing. So, identify the type of information that's needed, identify available information, determine the methods of obtaining information, search assessment resources, and evaluate and select an assessment instrument or strategy. So, when you're selecting the instrument or strategies for your assessment, these are the 5 things you want to look into to make sure that the test you're administering is going to provide the best services and the most valuable data that can attain to help us in whatever we're trying to do for our patient or student or a client, whatever you're administering an assessment for, right? So again, these items right here help to make sure that you're making that test effective and relevant to the person that you're assessing and the reason why you're assessing. So you also want to identify the type of information needed. Clients determine, counselors determine what information to collect based off the purpose of the assessment. So there's multiple reasons for assessment. There's multiple reasons why we assess. Um, we need to determine what information we need to collect and what the purpose of the assessment for when we're completing the assessment to make sure that we're using this again relevant for our client. You want to identify available information. Pre-existing assessment information about clients can include intake questionnaires, biographical data, preliminary diagnosis, school grades, previous assessment results, and anecdotal. I'm struggling with that word. Anecdotal. Anecdotal records. You guys know I struggle with pronouncing words. But again, that's all pre-existing assessment information about clients that we can include because again that's that relevant information that the history has been collected or the data has been collected in the past or whatnot that we can utilize for this assessment here. Determining the methods of obtaining information, you can choose whether to be formal or informal. Remember, formal is the more structured assessment. The informal is going to be the more free-flowing interview. May include interviews, tests, or observations. Use methods best suited for the client. That's going to fit your client the best. Again, meet the client where they are, right? And you're going to be responsible to choose those methods that are qualified to administer and interpret. So again, make sure that we are qualified to interpret the assessment and administer the assessment because again, counselors are again only allowed to do certain assessments. So resources, you have the mental measurement yearbook, tests that are in print, test critiques or tests. You have test publisher catalogs. They give you the cost of the test, the types of scoring and services that are available, and any other information that's going to be pertinent towards that test. So test manuals are really the primary way we look at the test and see how we're supposed to administer it. It gives us the purpose. It tells us the definition of constructs measured. It gives us a description of the intended population. It gives us information about the interpretation. And it also gives us manuals and user guides or whatnot for the test to help you actually administer it correctly, right? So again, there are some academic journals that can dedicate the exploration of the assessment. They give you more information and be a valuable resource for you. Again, there's an assessment on resources. You have the online test locator. These are different sites right here that are provided, and these PowerPoints are available for you guys in Canvas that you can look into and actually um, utilize to find test or locate test. You want to look at professional organizations like the American Education Research Association, or any of these that's listed here. The American Council Association is another one that's listed here that can be a valuable resource. You want to evaluate and select an assessment instrument or strategy, right? And these are some questions right here you want to ask yourself when you select the test. What's the purpose of the instrument? Who is it intended? What population is it intended for? What sample of the population was used in the instrument developed? Validation or norming. Again, making sure it measures the whole population. It's going to represent the whole population. Acceptable psychometric properties. Does the instrument manual provide clear and detailed instructions about the administration? Does the manual provide sufficient information about scoring, interpreting, and reporting the results? Is the instrument biased? So here we're talking about some things that are going to go to the standard of assessment, right? And things that we all have to be aware of and be cognizant of, right? We want to identify the gold standard assessment instruments that are commonly used for issues of the population. Those ones that um, have been proven to work, that have been proven to be evidence-based practice, that are out there and there's efficacy shown for them, right? Your agency uses screenings instead of more detailed assessments. So choosing one assessment that can be added to that will provide value to your agency. So again, your agency is going to have some pre-existing assessments that you're going to utilize to screen your clients, right? But using external assessments to validate what you get from that assessment, like a Beck's anxiety or a Beck's depression or a GAD or a Ch09 or any assessment like that to kind of validate your diagnosis if it's in those areas can be important. You want to evaluate and select the assessment instrument or strategy. You want to have there's some practical issues we got to look at. What's the time required for assessment? Again, long tests or can provide lower efficiency because it'd be too long for the client. What are the costs? What is the format? Is it readable? Is it easy to administer? Is it easy to score? Is there an easy interpretation? Before you administer a test, you should be familiar with the instrument. You should read and review the manual. Be familiar with the content of the assessment. Review directions for administration every time. Again, you want to keep reviewing to make sure that you're administering it correctly. For standardized tests, there's a scheduled date, room, facilities, a booklet, answer sheets, and pencils, and other materials that you must have. Obtain informed consent from the examinees, and provide orientation for examinees. During administration, there should be a final check of materials. Make sure that the lighting, the room is appropriate for the client and beneficial for the client to actually get to their ability. For standardized instruments, follow the administration procedures and deliver them verbatim, just how they're written, because again, these are standardized instruments. Establish rapport with the client and be alert to problems and client behaviors during the administration. After administration, collect the materials, count the booklets, pack materials according to the stated procedures, and record any incidents that may invalidate the scores. What may be some variance? What could have happened while we were taking the test? There can be some variance in the scores. So scoring and assessment instruments. So there can be hand scoring, where you grade it manual, computer scoring, where the computer generates the score for the assessment. You can send it out to the publisher for scoring, or self-scored by the client. Right? Those are all ways of the scores to be assessed. So performance assessments, we're talking about portfolios, projects, tasks, open-ended exercises, things that are done by the client to actually present certain information, or they're not clear cut, right? There's no right or wrong answers. And there's usually a scoring rubric for those, like we do with our assignments here. You see that in most of your syllabus for your signature assignments, there are rubrics provided that show you how we grade the assessment and how we measure what the results of your assignment was. So scoring errors, errors in hand scoring, assigning incorrect values, incorrectly recoding responses, incorrectly converting raw scores to derived scores, calculation errors can come into play, errors in computer scoring, that means inputting data incorrectly, incomplete erasures or stray marks can be with computer scoring. So when you interpret assessment results, again, you want to be able to explain the meaning of the variance standard scores and their implications to the test taker, because it's really important for the test taker to understand what the scores mean, how we calculate it, and what can be some of the issues or errors that can be within the test, right? Understand the factors that can affect assessment interpretation, like psychometric factors, test taker factors, contextual factors. right? So again, are there anything going on within the psychometric property, the reliability, the validity for the test? Is there anything going on with the test taker that cause the test taker not to have um, reach his true score, right? Or is there contextual factors going on that can cause a difference in scoring? So computer-generated reports and narratives can interpretations based on the test results may be very complex. They can be standalone, not standalone interpretations. Computers cannot incorporate uniqueness of the client, so they can't capture out the variance or the test taker situations that can cause a variance in the test scores. Right? It's very important for the counselor to be able to interpret the accuracy and the variance of the scores of the test taker, the psychometric properties, or anything else that can impact the test scores. So for standard and scoring and interpreting tests, report test results accurately and clearly in a manner that is understood by the test taker. Routinely review a sample of the test answer sheet to verify the accuracy of the initial scoring, and employ systematic procedures to verify the accuracy and consistency of computer scoring of answer sheets. So again, for those standardized tests, you want to make sure that your reporting is very accurate. You want to report that you're routinely reviewing the test and the accuracy of the initial scoring. You also want to make sure that all the procedures that were followed, that were utilized, were followed the manual and followed what was supposed to, how the test was supposed to be administered.